All right, come on in, folks. Come on in. The water is fine. Come on in. Come on in, folks. The water is fine. I know I repeat myself.
You said that already.
I know, but we weren't really alive yet. So
I see. Yeah.
Okay. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course.
And we are live. Today, Brad, we're going to talk about 10-minute ways. Oh, no. We're doing a 10-minute program for the lower back rehab. We're doing stretches and stabilization for back pain. And we're going from beginner to advanced. So, no matter what stage you're at, we got the answer for you.
There you go, Bob. That's what I like to hear.
By the way, and if you are new out there, folks, if you're on YouTube and you're new to our channel, please take a second to subscribe to videos how to stay healthy, fit, pain-free. We upload every day. Also, if you haven't already, please go over to Facebook and like us, because Brad and I don't know if you can see that. I got a sign made up. Yeah, I can see it. I don't know why you can see it or not.
The letters are backwards, Bob.
Yeah, they are backwards. We want to make sure you know where to find us on Facebook. It's Bob and Brad on Facebook. And again, like us, because Brad and I, as children, were not liked. We were bullied. We were picked on. And we're trying to turn things around. And we're doing that. We're getting there.
Yeah, even though it's not true, we still have fun.
So, all right, we're going to run things like we always run things, a little chaotic, but we'll get there. What we're going to do today is we're going to go over our program, our 10-minute lower back rehab program. And then after we're done with that, we'll go ahead and take questions. So this should take hopefully 10 minutes if we're doing it right. Then we'll, like we said, queue up the questions and we'll get to them. All right, we're going to start off with, you want to do a little bit of a warm-up. So we're going to go ahead, and these can be done on the floor. A lot of them can be done on a bed, too, if you can't get down onto the floor. But we're going to start off with just some trunk rotations. This is a great, I think I'll have you do it, Brad. I'm going to point it out on you.
Okay.
We're on the fly here. All right, so what I want to see here is Brad's just going to keep his heels together on the bed, and then he's rotating his legs back and forth. This is a great warm-up for the back. It's a great stretch for the back. If it hurts in one direction, don't go in that direction. You remember the old joke from the doctor? It hurts when I do that. Well, don't do that. Well, that's what we want the same. So if it hurts going to the left, Brad's just going to the right for a while, and then he'll check the left again later on to see if that's loosened up. So great way to loosen up the back. And now the next one we're going to do is we're going to do some posterior pelvic tilts. Now, this is really important for you to understand this, that you want to be able to flatten your pelvis out here, because that's the way you can find the neutral position for your pelvis when you're doing lifts and stuff like that. So right now, if I were to put my hand underneath here, he's got an arch there, and now he's squishing my hand. So he's squishing anything that'd be underneath there right now. If there was a towel on there, he'd squish it. And you
can put your hand under there.
Yep. He's doing the posterior pelvic tilt. And that's warming that up. And it's something, again, you want to be able to go anterior and posterior on that over time.
Good core exercise, too.
All right, next one, Brad. We're going to supine. And this is going to be, again, we're going really basic here, very simple. You're going to start off with you're laying on your back, and you're just going to go ahead and lift your leg up like this. And you're starting to work the core a little bit. Very easy to do. How many have we done, Brad?
3.5, Bob.
We'll keep going. We'll warm up.
We're in sync, Bob. It looks like we practiced this.
Yeah.
Wow.
You must be watching me because I'm not watching you. So, all right, to make it a little bit harder now, we're going to go ahead and bring the leg out and bring the leg up like this. I'm switching, Brad. I'm going to go full legs like this.
Oh, yeah. I'm catching on. I'm a little slow sometimes, Bob, but you can't get me for too long. Yeah, this is working the core. Now, when you do this, try and keep your back flat to the bed or to the floor, so your tummy muscles are going to have a little tight at all times, stabilizing that low back.
I forgot to mention the book, Brad. Is the book by you?
Oh, yes, it's here. You want me to bring it out?
Yeah, why don't you bring it out just real quick, taking a little intermission. A lot of these exercises are based on, it's called Lumbar Spinal Stabilization by Donald R. Murphy and Gary Ierna. They're both chiropractors, and it's just has a lot of the exercises we're doing today in the book with a few more too. So if you want to have something you can hold on to while you're doing these, you can use that.
It's got some nice photographs. It's a good pamphlet. I like it.
All right, next one, we're going to put your arms up over your head like this, Brad.
Oh, yeah.
We're just going to go opposite arm, opposite leg. going up to, about neutral here. Good.
Keep breathing as you do these. Make sure you breathe. Inhale through the nose, exhale out the mouth. That makes a big difference. It's going to have more endurance. You're going to be more relaxed.
Okay. Next one, Brad.
Yes.
The old. This one's a little bit tougher.
Yeah.
This one's a little bit tougher. If it's hard for you, you can start by tapping your heel.
Yeah. I like to put my hands underneath my sacrum like this, and that gives me a little more support on my back, and I just feels better, and my hands stay warmer.
Good point. Yeah. Especially in those cold winter months.
All right. We got snow here, so.
Yeah, we're in April here in Minnesota, and we've got, it was 10 degrees this morning, and we have a foot of snow on the ground. It's just not fair.
We're just lucky, Bob.
Yeah, we're just lucky. All right, next one, Brad. Start with the arms up and legs up like this.
Yeah.
This is called a dead bug.
Oh, yeah.
Opposite arm, opposite leg.
Yeah.
So this one's getting a little bit tougher, isn't it, Brad?
Oh, yeah. You can feel a little, it looks kind of stupid in my opinion, but it really works the stomach muscles well. And you get some arm motion in there. You can tell by the tone of my voice that I'm doing a little work. Are we done yet, Bob?
Yeah, we can be done anytime now, Brad. So, so if that looks stupid and we're stupid, does that cancel out? I'm wondering.
Yeah, 2 negatives make a positive. We're
genius. All right, next one, Brad. We're going to do, this one's a little bit tougher too. You're going to bring the legs up, and now you're rotating back and forth like this. Can you do that one with your spondylolisthesis?
Yeah, but I'm not going to go real far.
Yeah, so you're just going past and forth, back and forth here.
Pain-free range. If any of these hurt your back, you should not be doing them. We're just working on core strengthening. We don't want to irritate it. So use good judgment.
I would say you're getting the transverse abdominis here and probably obliques with this. Wouldn't you say?
Sure, you bet.
And you're always getting the rectus abdominis.
Right. You're not going to isolate all, certain ones that have that. Everything works together so well. The human body's incredulous.
Incredulous?
Well, it's going to be one of those terms that they have in the dictionary in about 10 years from now.
Yeah. That's just the wrong use of it, I think. But anyway, all right, Brad, let's do some curls. I like to do them this way, Brad. I just like to go up to the ceiling. Try to reach your hands up to the ceiling like that.
Yeah.
Because I don't even like you to curl like this. I don't like you to curl the back. Yeah. I like to just go up like this.
And don't let your head go forward and look at your knees. Keep looking at the ceiling.
Yeah.
Maintain a neutral neck.
I've got a water sprinkler right above me.
Oh, yeah.
A sprinkler.
Yeah, that'd be fun to turn it on.
Yeah, it'd be directly on me.
Yeah. That'd cool you off.
The things we talk about, huh, Brad?
What's next?
Okay, simple one next is basic bridging. So we're just going to go ahead and lift up like this.
Now, for us, bridging is like, we've heard that term for 30 years, but bridging just means you go up, get your hips up as if a boat could go underneath your butt. That's what I tell my patients that aren't familiar with it.
A boat can go up your butt. Oh,
underneath it.
Oh, I thought you said go up your butt.
Well, this is a family show. Would you just relax? I'm embarrassed now.
Well, as you should be.
I said underneath, didn't I?
I think you did. I think I misconstrued.
Well, yeah. Let's go on with the
All right, next one, Brad, you're probably not going to want to do. This is a side bridge.
Yeah.
And I'm going to do it from my knees like this. And I'm actually going to dip down like this.
This one puts a fair amount of stress on the back if it's not healthy. Like mine's got spondylolisthesis, and it does not tolerate this motion with stress on it. I would be very sore if I did this one.
Now I'm going to do it with the legs straight, and this is even harder now.
There you go. This is pretty advanced, so you don't expect that you can do this one unless you're feeling pretty good and you're pretty strong historically.
Okay, next one we're going to do, Brad. This one's a great one for most people. Except, again, if you have spinal stenosis or spondylolisthesis, you might want to skip this one. But it's just a universal press up, Brad. So we're going to keep your pelvis on the ground, and we're going to start pressing up. And, you can do just a low amount here, a low distance, or you can start working all the way up. But, again, the whole idea is don't let the pelvis come off the ground.
Right. So you notice I'm not doing them because there's two conditions you certainly don't want to do this with, and the one is spondylolisthesis like I have, or if you have spinal stenosis, this typically is going to irritate your back, and I don't have near this range because of my situation. So, and if you don't have those two, I would highly recommend you do this one. It probably is the most important one for you to do.
And I do it twice a day. I do it when I wake up in the morning. I also do it later on.
How many repetitions each time?
I do 20.
20, okay.
Yep. All right, next one, Brad. The old famous cat camel. Now this is more mid-back. So when I'm going down, I'm bringing my head down. I'm bringing the hump up, my head down.
Yeah, I'm showing with a stick.
Well, thanks a lot for letting me.
Well, don't worry about that. It's just your head. There you go. You got a nice arch in your back. Got a good camel cow or camel cat or whatever you would like to call it.
Whatever animal.
Yeah.
You remember a liger?
A liger?
Yeah, that was
a cross between a tiger and a lion.
That was from Napoleon Dynamite. The movie,
really?
A liger.
I never heard of it.
Anybody heard of it out there? Give me a comment so I want to make sure I'm not out here alone.
Yeah.
All right, next one, Brad. We're gonna do. I've lost my place.
Left field.
Oh, single leg or single arm. I'm sorry. You're gonna just get in the quadruped position. You're just gonna start raising the arm up here.
No, you're getting to my situation. I'm happy.
Now, what I like to do with these, Brad, is I like to go ahead up to the front, side, and back.
And that's not necessarily for the back, but it's more for the low back.
It's more, yeah. This is more for the mid back. But we're going to get to the low back.
Right. We got to put a little bonus in there.
So now we're going to go ahead and we're going to work one leg here.
Oh, now I'm going to bend my knee up here. It's a little easier. So that's an option. Do it like Bob's doing it or like I'm doing it.
Or you can even go like this, which gets more buttock here, actually.
Right. Ooh. Just be careful about your hamstrings. I can feel mine get twingy, starting to want to cramp. I'm going to straighten it out. I'm going to stop doing it.
All right, now we're going to go opposite arm, opposite leg. And this is the one where I like to go out to the side and back.
This was one that is much harder than it looks.
Yeah, you need some balance for this.
Mm-hmm.
You're kind of an unstable surface there, too.
Yeah.
Now we get the other arm here, too. The other side. Whoop, I lost my balance. You got me.
Yeah, I want everyone out there viewing, get on the floor and just try this one out. See it happen. You'll have fun. It would be nice if we could have all 20 million people doing this at once.
It's kind of a pointer dog.
Yeah.
You know?
Yep.
That way, boss.
That's what one of my patients started calling it years ago. He said the pointer dog. It's a nice name.
All right, next one, Brad. We're going to go ahead and do forward lunges now. So now we're starting to get into more of a functional approach here. And this is something that you're going to use in real life because let's say you're going to pick something up off the floor. A good way to do so is to go like this and dip down, keeping my back straight. I can pick something up like this. So if you do forward lunges like this and you go down, again, I'm keeping my back straight.
Do you need something for balance, Bob?
No, I'm good.
Okay.
It just took me a second to get recalibrated here.
So you're getting a good exercise on your legs. You're protecting your back. Getting some good practice on body mechanics.
I don't know what you want to do with your arms. You want to go up? What are you going to do with them?
Well, you do them with whatever you want, Bob, but I like what you're doing there. You get some shoulder movement in there. Are you breathing, Bob?
Yeah, I'm trying to breathe.
Mm.
All right, then I was going to do, actually I was going to show some, get a little more advanced. These are things I do. I do some kettlebell swings, Brad.
Sure.
So these are a great one to do to work on the entire posterior chain, they call it. So it's working back, buttock, actually hamstrings, and even calf muscles a little bit here. So you want to get your back in good position here. I like to turn my feet out about a little bit like that.
Yep.
When I'm doing them. So I'm going to turn them out. My back is straight. I'm going like this. And what you're doing, you're hinging the hip.
Yeah. Well, look at that. He's got a nice arch in his back. I can keep my hand in between there.
And I'm not lifting my arms. I'm just thrusting my pelvis.
Right. So you're working the hips and the legs.
Yep.
The arms just go from the momentum.
How do I look?
Oh, Bob, you look incredible. Looks like
fabulous,
looks like you're getting ready to go hunting out in the woods.
So this is all coming from my hips. I'm not lifting my arms. My arms are just swinging naturally.
Yep.
I'll do it this way too.
Now this is more advanced. You have to be confident in your body mechanics. It should not irritate your back. Just fatigue it. This is one I personally will not do because of my spondy. I know I get a sore back after doing that one. I've got other options that work very well though. We got videos on that too if you happen to do one of those.
I think you can actually do hundreds of those, Brad. I mean, well, not hundreds,
right.
But you can do lots of these.
You can build up some endurance and strength with that.
Yeah. Looks like Lonnie's going to leave us.
Oh, bye, Lonnie.
All right, and then we're going to do a little bit of a cool down. I like to cool down doing the press ups again, Brad. Why don't you start looking at questions here?
Sure.
But I actually like to cool down doing some of these, especially again, if you don't have SPONY, you don't have spinal stenosis. This is a great one just to finish with because we spend most of our day bending forward. So this is taking us in the opposite direction. Anybody with a question?
Someone's talking about with knee replacement. Actually, she has a bilateral knee replacement, but I would be true with one knee. For my options, if they can't get down on their knees with some of these.
Well, you can do all the supine ones.
Sure.
I mean, what I meant by supine, you can do all the ones laying on your back.
Right.
And you can certainly do them on the bed. And you certainly can do this one and, all these.
Right.
I mean, so there's lots of ones that you can do.
You could, if you're young enough and able enough, you could use the ball and probably let the ball support you prone.
Sure.
Should we show that one?
Yeah, why don't you show that, Brad?
Okay. Let's get the blue one down. I have a feeling I need a bigger ball. So you have to feel stable with the ball, but I'm going to go down like this. And now my knees are not even touching the floor. So then you can work the back. We're doing the exact same exercises we were showing you. And then we're going to do the pointer dog. And there's no stress on the knee.
Yeah, it works out really well.
Yeah, it's just a matter of being confident with the ball. If you haven't done it before, you have a ball, make sure you have someone help you so you're safe. If you're concerned about it, I would not do it. Good.
Somebody was asking about are treadmills bad for backs? There's a couple things I'd be careful of with a treadmill. One, I would not have it at an incline at all.
Right.
And in fact, mine has a natural incline to it. So I actually went underneath and I, screwed the back legs in, so I was completely level.
So you modified it to get on the level.
Yeah, I want you to be completely level when you're walking. And then, of course, some of the models are a lot harder than others. There's no shock absorption.
Sure, right.
Especially some of the home models. And I mean, you really got to go by symptoms. I mean, you should, the first time you get on it, I'd only go for a few minutes.
Mm-hmm.
And then see, were your symptoms worse afterwards? Were they worse the next day?
Right.
If not, go ahead and go up to 5 minutes, go up
Right.
to 10 minutes, gradually, incrementally increase.
Oftentimes, back pain and walking go together well.
Right.
But it should feel good. I just had a patient yesterday. She's in a lot of back pain, but if she walks, it feels better. So that's part of her exercise.
That's fantastic. If that's the case. If you can get up to like 20 minutes of walking, that's really the
right.
cat's meow.
As long as it's feeling good, it's not irritating.
Lonnie, did you want to throw a question out there?
What is it that hurts on my outer mid-thigh?
Outer mid-thigh?
Yeah.
So someone's asking, what is hurting on her outer mid-thigh? Now, that can be your back. Now, if you do some back things like bending forward and bending back, and you get increased pain there, it could be coming from your back.
Referral pain going down.
It's hard to distinguish right now, because it takes a full assessment by somebody.
Right. I mean, there's the IT band. It could be something from your.
It could be a bursitis.
Right from the hip. So over the internet, it's really hard to be confident on giving you a good answer.
Yeah, I'm sorry that we're not trying to skip out on an answer, but it's just it could be so many different things, and everything is going to be treated way differently. So we don't want to give you the wrong advice.
Right.
So, all right.
What you do the ball exercise with herniated disc that is almost healed?
If you have a herniated disc that's almost healed, now I'm assuming with that being mentioned that you don't have any leg pain or symptoms down the leg, things are getting strong. You could actually do the exact same exercises I showed you there. At that point, I guess I can go through. So and this is nice because it takes pressure off the back, but you're still working the muscles around the injured area. And again, they should be pain-free. It should feel comfortable. If it's almost healed, you may be able to do some anterior core strengthening. You grab the ball like this. Again, this should not irritate it. If it does, it's not ready for it yet. But if it's almost healed, then this would be good for it. Wouldn't you say, Bob?
Well, let's show the back extensions on there, Red.
Oh, yeah, good.
It's a good one to do. This is a good one to do for the herniated disc. because you're getting some strengthening, but you're also getting some extensions there. So that's a great one to do on the ball with a herniated disc.
And if you notice, my hands are on the ball and actually assisting with the movement. As you get stronger and near full recovery, you can do it with your hands off, and then it's a little more aggressive. But use good judgment on that and start out with it the easy way. Where you position yourself on the ball, it's much harder here than if I do it here. So you start easier and work yourself to the harder position. Good question.
Les has a question about, is it okay to use an exercise bicycle, exercise bicycle when you got back pain? It's a good question, and I would be a little bit leery of that, Brad.
Right.
If I were to be on an exercise bike, I mean, for one thing, it's kind of bringing you into flexion a lot of times a little bit, and then your leg comes up and your knee brings your back even more into flexion.
Mm-hmm.
I mean, I would have the seat set up very high,
Sure.
So you're keeping your back straight and you're extending. As a rule of thumb, I probably would not have somebody do the home exercise bike.
No, not only if their back is feeling pretty darn good, and maybe they want to get back to biking. Then we'd work on posture.
Yeah.
And when I bike with I'll sit up straight because I have an inside trainer, basically a stationary bike, and I find myself sitting up tall while I pedal, and then I'll lean forward in the handlebars every now and then.
Sure.
With modifications, it could be used.
It's a good question, and I would be a little leery of it, I guess, in the end.
Yeah,
so
for sure.
Lonnie?
So what weight of kettlebell should I use?
What weight of kettlebell? You want to start off very light,
Right.
and then, but I mean, people get up to 50 pounds and stuff. I'm at 20 pounds right now,
Mhm.
and I'm actually going to bring this one home, and I'm going to do both at the same time. So
Sure.
I'm going to go up to 35.
But the goal is not to see how heavy you can get, even though if you're a man, it is, even if it's not. I know you want to get heavier.
Women too. A lot of women they want to get.
But you're going to start out with light because
Yeah.
you're going to find out if you do it properly and you haven't done it before. I mean, I would just do it without anyway, just so you can practice your form.
Yeah, that's a good point, Brad.
And then just start with a lightweight.
Yeah, because it actually really works the hamstrings well, which helps protect the back. You know, I mean, so
again, good posture like Bob demonstrated.
Is swimming freestyle with lower back pain okay?
If it doesn't irritate it.
Say the question, Brad.
If swimming freestyle or the crawl, is it okay for back pain? And oftentimes it is because it's non-weight bearing, but I know I can speak from experience. I've had back pain and I go swimming, and because of the rotation when you swim, sometimes I can irritate that back depending on what level of pain you're in. But in general, I'd say yes, go ahead and do it.
I would say be just like the treadmill. Try a few, a length or two.
Right.
And don't go crazy the first day,
Right.
And then see how you respond to it.
Right.
I mean, give yourself some time to adapt to it.
Yep.
So, all right. Let's see.
I wake up every morning with lower back ache. I put pillow between my knees and I sleep on my side with one pillow. The ache goes once I'm up. Could it be my mattress or something else?
Well, you could try another thing too. You might try a roll. You want to pull that out, Brad? The other thing is, it just might be that, during the night, you're not moving. The back isn't moving. If you have a little arthritis in your back, it's going to feel better once it gets moving.
Right.
But you can take a rolled sheet and put it around you. And what that's going to do is it's going to fill in the gap here when you're on your side. So your back isn't sinking down now like this into the mattress.
So that roll goes just above your pelvis, where your pelvis bone is. It's above that in that soft spot of your waist.
And you can also roll on your back, and it gives you support.
Right.
Now they also make one like this that you can purchase. We always have it in our Amazon section down below. Preferred, and you can tie it in place. And again, when he lays on his side, it fills in the gap, and when you lay on your back, it fills in the gap.
This is called the sleep roll. It's a McKenzie sleep roll, by the way.
One thing that I would do, when you get up in the morning, before you even get out of bed, I would wake up and I would put your legs in that position, and I would do those, windshield wipers or whatever you want to call them, keeping the knees together.
We started the video out with these right at the very first exercise.
This will get your back warmed up before the day even starts and before you even get out of bed. And it'll get all that synovial fluid and everything going and the discs are warmed up.
So you're actually getting warmed up before you get out of bed.
It's like horseback riding bad for spondylolisthesis?
Well, I won't ride a horse.
Say the question again, Brad.
Is horseback riding going to be hard on someone with spondylolisthesis? And I would say absolutely. I don't know anything about horseback riding, but I have ridden a horse, and I don't know how to get the bumps. I'm always bouncing my bottom on the seat.
The jarring is too
but
hard on your
even
back.
if you're a good horseback rider, it's going to be challenging. It's probably going to irritate it.
All right. Someone wants to know what I should do to fix my bowed legs. So they're bowed out like this. This is a tough one. You know, one thing I want you to make sure is that you have new shoes. Because what I see a lot of times with people with bow legs, they've wore out the outside of their shoes. So that makes them bow even more.
Right.
So you really want to have nice shoes, maybe with, maybe within, even an insert. I guess an insert would help though, wouldn't it?
Yeah, if it's genuine.
It would make it worse.
Right.
No, just have good shoes that aren't wore out and you keep them in. Once if you're bowed and it's because of a bony deformity, there's not much you can do about it.
Right.
I mean, besides eventually have a knee replacement and they straighten it out there.
Yeah. We do have a video on that. And we show some exercises for maintenance.
Right, to stop it from getting worse.
But like Bob says, if it is the joint and it's a bony issue, you're not going to change that unless you have surgery.
Right. All right, maybe we take one more or so.
Okay.
Anything on you got, Lonnie? Or I'm going to try to go back here.
Maybe I should do a little dance. I was practicing that before.
I get a very painful back after lying flat. I find it very painful to turn over. Any exercises that can be done to help this?
Again, if someone is having a lot of back pain when they lay flat on their back, that's kind of the summary of it, Lonnie. So, one thing, you could again try that sleep roll.
Sure.
That will give you some support in there, the one we just showed. Or you can. The other thing is, before you get up out of bed, get some movement going. So you want to go ahead and do some rotations here. I don't know. Do you have any other suggestion for that, Brad? I mean, if it's an uncomfortable position, I would avoid it.
Right.
Too. I would.
I mean, and of course, there's always the possibility of a different mattress. You need a firm one, a medium one, a soft one.
Good point.
And that gets another subject. Matter of fact, I was just bed shopping last night, getting the latest on the updates of beds. So.
Well, the other thing is sometimes people take a foam topper and put it on top of their bed. And sometimes that fills in the gaps and it feels a lot more comfortable.
Yeah, I like the memory foam toppers. You can get them about a couple inches thick. I know I got one for my daughter in a dorm room when she's in college, and she said it made a tremendous difference on the comfort when they're sleeping.
That'd be something else to possibly try.
Yeah.
All right, folks, we better get back to work here or get to work or something like that. Thanks for watching. We won't be live next week. I'm going to be in Seattle, Washington. If you're out there, say hi to me.
Yeah.
But we will have videos. We just won't have any live ones.
Yeah, very good.
Thanks for watching.
Have a good flight, Bob.
Thanks.